We're going to deal with lateral spinal stenosis. This is stenosis in the intervertebral foramen. You're probably familiar with the anatomy of the blood supply to the spinal cord and the cauda equina. In the cauda equina in the lumbar spine, the blood supply from above is the proximal radicular artery, and the blood supply from below up is the distal radicular artery. The proximal artery runs through the spinal canal, but the distal artery comes back through the intervertebral foramen. And these two circulations join in the medial part of the intervertebral foramen. So this procedure is going to increase the volume of the intervertebral foramen. Again, the belt's just going to go above the PSIS. You can cross your arms and your shoulders this time. Now, obviously, some overlap is going to occur. You know, when I do central spinal stenosis procedure, it's going to affect the intervertebral foramen. And when I do intervertebral foramen procedures, it's going to affect the central canal as well. There's a lot of other things that are affected as well, because I'm not just pulling or stretching one structure. The traction happens on a lot of structures. It happens on the nerves, it happens on the joint capsules, it happens on the ligaments, it happens on the muscles, it happens on the bone. Now, let's suppose she has sciatica. Suppose she has sciatica down her left side. And it might be from the intervertebral foramen, not necessarily a bulging disc. Maybe there's, perhaps there's a non-vascular edema set up from old injuries from the disc and the nerve in the past, and the intervertebral area has this non-vascular edema. It has neogeneration, neurogenesis and angiogenesis taking place. Is this non-vascular edema and no blood flow. So what I'm going to do is try and pump that fluid out of the intervertebral foramen now. Now, how can I tell if the patient's responding or not? If it's a good procedure for the patient? Well, they tell me. Intervertebral foramen. Pressure on, pressure off. I'm always looking at the patient's eyes to get their response. You may have to start very gentle with this, and it might be sore at first. But as you continue the procedure, they quite often feel better, and again, they get this warming sensation. So I hold the pressure on, I hold it to give that fluid enough time to move, and then relax. Hold it, and then relax. If the person doesn't feel the stretch there, or the person feels it's not in the correct location, I may have to bend the hip up a little more. I might have someone to help me hold that leg. Bend the hip up a little more, or a little less flexion in the hip.